Yes, we've had these concerns that we can't feed these babies very quickly. This is a trial that was done in the UK, and the title of this was a controlled trial of 2 incremental milk feeding rates in preterm infants, sometimes referred to as the SIFT trial. And what they did in this study was they compared an advancement of 18 milligrams per kilo per day versus 30 milligrams per kilo per day, okay? What they found was that there was no difference between the groups in terms of necrotizing enterocolitis, sepsis, or adverse outcomes. The groups that were fed more rapidly actually had less time on TPN, which would be expected, okay? So there seemed to be some slight advantages to going a little bit faster. However, I have to warn you about this, because one size does not fit all, and you will hear this several times over. One size does not fit all. This lady, Professor Sushma Nangia, is a professor of pediatrics and neonatology in New Delhi. And I first heard her talking about this topic several years ago. And one of the things she was doing was feeding babies enterally, premature babies enterally, faster than what most people would feed them. So if you look to your, I wish that this was working better, if you look at the table at the left here, you see early total enteral feeding versus conventional feeding. Conventional feeding was advancing at 20 milliliters per kilo per day. And the early total enteral feeding was advancing much faster, so that usually by around 5 days, 6 days, that's what you see here on the right side of the slide, you see that the early total enteral feeding, those babies received full enteral feedings by 6 days, whereas the conventional feeding did not receive it until 10 days. And they found, and she found that this was actually beneficial in many ways. Secondary outcomes showed some benefits, including getting these babies off of the IV much faster. Using this technique, many babies did not even require an IV. Did not even require an IV if they didn't have hypoglycemia, because they were able to get the feedings up to full feedings so quickly. Well, I was initially skeptical when I saw these studies. And you have to remember that these were babies with an average gestational age of 31 weeks, 32 weeks gestation. Okay? So these were bigger premature babies. But I was initially skeptical because I thought that in India, babies tend to be more small for gestational age, more IUGR than we would have in the United States and many other places. But then some others repeated these studies. And this is one of a couple of studies now from the United States done by Dr. Ariel Salas. And the title of this was Early and Exclusive Enteral Nutrition in Infants Born Very Preterm. And they found the same thing in the US population, that they could get these babies up to full enteral feedings if they were more like 31, 32 weeks gestation without even starting total parenteral nutrition. And many of these babies didn't even need an IV. So very interesting. So that's one end of the spectrum. What about the other end of the spectrum? What about babies like this, our little 25, 26 weekers that we put on CPAP or NIPPV? We see this kind of a thing. We see CPAP bellies. We see this distension of the abdomen. And if you see this,